Right, we've got a lot of ground to cover, so I don't want to waste any time. It's also a really exciting and interesting topic that is very pertinent. So today we're going to spend the next half an hour going through the practical guidance for public health departments and agencies around AI policies. And this webinar sort of formed out of our recent webinar through our partnership with NACCHO, where we discussed AI use cases in public health, what AI can and can't do. If you'd like to see that webinar, we do have a recording of it that we can link to. But we ran a couple of polls during that webinar asking people's comfort levels with AR use cases, et cetera. And one of the responses that was made loud and clear by the over 800 attendees on the webinar was governance and AI policies were something missing at their department. So we are very fortunate to be joined by Aaron Davis and Tatiana Lin, both of whom come to us from Kansas. Aaron is the director of the Community Engagement Institute, and Tatiana is at the Kansas Health Institute, but both of them have been working on frameworks and structures for AI policies. Jump to the next slide. So just to level set, I think what we've recognized through a number of conversations with you all and across the industry and at a number of conferences this year, including the NACCHO 360 conference, is that AI is out there, it's here, but it's not dispersed evenly. People are a little uncertain about what the use cases are, consistency around how it should be governed and used within their organization. Issues with incorrect answers or hallucinations. So all that fragmentation is really guiding us at Metopia on how we build our platform and how we engage with you all to make sure that people feel comfortable and confident when they use AI. When we talk about AI, it means a number of different things. So what we are commonly referring to now in the industry is essentially large language models. So this is like a predictive text model. And most of you are probably familiar with things like ChatGPT, where you or a family member might go in and say, hey, make a silly image of something, or, what's the capital of Indiana or something like that, and it will produce an answer, or help me write an email and so forth. That's sort of a public-facing use of AI, but AI is becoming quite ubiquitous across software platforms. So just as an example, at Metopio, we have a number of different AIs deployments in the platform. So we do have a large language model that supports analysis and decision support and drafting of things like a community health assessment or a report. But what you actually see on the screen in this little video that's running is a text to SQL bot. So this is an AI use case where somebody is asking plain language questions about their survey data, so line level survey data. And the AI is actually taking that plain language and turning that into SQL code and fetching the data and returning it as visualizations. So in this case, the AI agent is actually serving as a coder. It's not touching the data at all. It's just sort of the intermediary between a person asking a question and somebody getting an answer in the platform. We also use AI and sentiment analysis. It's much more effective than machine learning algorithms for being quite accurate with sentiment. But there's so many different use cases and there's so many different ways AI is being deployed. So we're really thinking about this as a catch-all. But with that, you really need to have a strong governance framework, because it's not just oh, we've got AI at our public health department now. We need to think about AI, the human impact, the ethical considerations, and all the rest. So with that, I'm very excited to turn it over to two experts in this field, Tatiana and Aaron, who are going to take us through the processes and considerations that they've been working on as they develop AI policies. So happy to have you all here. Jump right in.
All right. Well, thanks for that, Will. So thank everyone for joining us today. Tatiana and I are going to go through a couple of elements today when thinking about AI policies. Hopefully, we will be able to give you not just some recognition of why policies are needed, but help you make the building blocks of how to get started if you haven't, or how to kind of reassure yourself that you're on the right path if you've already started that journey. So I think one of the things we want to start with is, Aaron, if you can drop that in the chat. We have a note taker that's just a PDF that you can download and use that to take some notes on and follow along. It's just a PDF. So it kind of gives you a reference both to collect questions and thoughts as we go along in the next 30 minutes of what you're hearing and what we might want to follow up on. So, quick introductions. Again, Aaron Davis with the Center for Public Health Initiatives at Wichita State University. We are housed in what's called the Community Engagement Institute. So, I'll be brief on this. We exist to basically make communities in Kansas stronger. Specifically, our center on the public health side recognizes there are lots of levels and interventions in terms of public health. I got my start working at one of the largest health departments in the state and then transitioned over here to help statewide. One of my passions is local government. So when we think about AI, one of the biggest drivers for me personally is the fact that we know the future of public health is going to involve some new technology, some new ways to go about doing this work. And I really want to lean in and make sure that government continues to not fall behind. So with that, Tatiana, do you want to go ahead and introduce yourself?
Good morning or good afternoon. Tatiana Lin, I'm a Director of Business Strategy Innovation at the Kansas Health Institute. We are one of the public health institutes. We are a nonprofit, nonpartisan. We're working with a lot of stakeholder groups, including organizations, agencies, community groups. And really, our mission is to advance the health of all Kansas, but also contribute to the broader public health conversation. So look forward to discussing the AI policy framework with you all today.
And you might be asking yourself, okay, two folks from Kansas, why are they talking to us about artificial intelligence? It's not just all wheat fields in Kansas, we promise. But Tatiana and I, have really been leaning into AI, honestly, ever since ChatGPT first rolled out. So we have been working, especially the last 2 years, developing resources and toolkits and the policy guide we will introduce you to today. We've also helped co-author some various policies across both local, state, and nationally, including some of the elements of the APHA policy. We've started a community of practice both in Kansas and supporting NNPHI, the National Network of Public Health Institutes. We've been testing tools. We've been traveling across the country and even internationally, some in person, some virtual, of course, and really been sharing our knowledge and our lessons learned in terms of AI use and adoption. And we're going to share some of those elements with you today, but also hearing from everybody how they are using AI, what their hurdles are, what some of those struggles are. So we'll share a little bit more about some of the educational sessions that we have helped put together and continue to do across the country. When we think about policy, there's always a starting block. And I think one of the biggest things that we want to lean into is making sure you know the context. When we say policy, what does this look like in terms of your organization? So we have developed from our conversations this concept of what we would call the AI fluency ladder for organizations. So it's not just the individual thoughts on AI, it's as an organization, how are we applying this? So from the bottom up, we know that we need to build in organizations an awareness and foundation of what AI is. From there, we know people are going to start using it. Most everyone has. When we start doing surveys, it goes from a small percentage not using it, and as we go along, more and more people are testing this out. So we want to talk about what that individual application looks like, and then we start talking about big picture. Let's lean into AI for projects and workflows and really figuring things out and using it in our organization. And we're not going to be there yet, but in a few years, everyone will be at this enterprise transformation in that we know across the board AI and these systems are going to be ubiquitous, just like we use Microsoft Word and Excel and those sorts of things. So to give really quick breakdowns, when we think about this phase one awareness, there's lots of things to consider when we talk about AI literacy, really having a shared understanding. So not just letting people figure this out on their own, but having a organizational effort to build a shared understanding. Many of you will know when you start using something like ChatGPT or Microsoft Copilot, there's pros and cons, there's good and bad. So the more that we are using the same language around those things and understanding how it gets applied, and some of what Will covered, it's not just those systems, it's being built into things, the better we're going to be able to tackle these issues and start adopting AI use responsibly. So then we go to phase two, which is, of course, the creative part. This is what I love the most because we're really talking about individuals figuring out how to use AI. And with that, we got to do this responsibly. Let's talk about not just using it randomly, but what's our rationale for using AI? Why do we want to use it? And have some open conversations. Let's do this in a way that we're understanding how we're moving things forward. With that, we know that we're going to need some level of training and support. We're going to need some guardrails. What are the things we should use AI for and should not use AI? And again, this is really on that individual level. So from there, what that looks like, these are some of the things that we actually do trainings on. How do we draft policies or analyze policies? How do we use these systems to write better? It's not always as easy as just throwing it in a system like Copilot or ChatGPT and saying, make this document better. We really want people to learn how to prompt and utilize these systems in a way that helps move them forward. We know that there's lots of support on the administrative side, making sure that minutes and details and things get pulled together. Let's save some time. But then also when it comes to details, especially in the public health world, how do we communicate with the public about these complex issues? And if we don't have a communications person, can we lean in on social media or to be a sounding board on new grant ideas that we want to apply for? And of course, we love the engagement side of these systems when we do trainings as well, making sure that people are thinking about creative uses. And I like to leave devil's advocate on there because it's great to brainstorm with these systems. So that's what that initial individual application looks like. Then we start getting into some fun. Big picture, what does it look like to utilize applications that are not just using a chat GPT or a Microsoft Copilot or Gemini, but using some of the back end or building systems, some of what Will was talking about. When all of our vendors start using these systems, we need to make sure that we understand big picture what AI is, pros and cons, how these things work. And that really starts with what we recommend, developing a cross-functional AI work group or a team that will lean into these things, and not just the frontline staff, but this is where we know we need to include IT, HR, legal, different perspectives of the organization. And this is where we start thinking not just the do's and don'ts, but also the details of getting it on paper, drafting guidelines and policies, which we'll go over in just a second. Thinking about performance measures, we want to make sure that we are applying these things effectively. Think of AI as a quality improvement project. Why are we doing it? What are we trying to get out of it? And then we can turn around and see if this is actually beneficial for our organization. So lastly, think about low risk pilots, explorations of how we might utilize these things in ways that aren't going to scare us, scare IT, scare HR. And then we can start really figuring out what does it look like to move forward responsibly. So those are the things where we actually define why we're using the system and how, making sure that we have human oversight, nobody's submitting or creating anything that they shouldn't be putting out to the general public, and capturing lessons learned, thinking about quality improvement. And again, revitalize or rework your guidelines, your policies to make sure that you are doing things appropriately, that we're taking a look at these things and keeping it live. Because eventually we get to phase 4, which is when these systems are, again, throughout everything we do. And we need to make sure that we understand those pieces and we're adopting AI responsibly, because it is not going anywhere. If anything, it's going to become more and more a part of our daily routines, which is why we're here today talking to you about the policy piece of it. But I'm going to turn it over to Tatiana as we start leaning into those details.
Wonderful. And thank you, Aaron. Let's talk about policy. And so how do we really develop a policy that meets our needs, that balances the safeguards that need to be put in place, as well as with innovation? So the conversation today will be grounded in this resource. It's called AI Template and Guidance. You have a QR code, and I believe you'll also have a link in the chat. And what this resource really includes, it provides the rationale of how you can develop different sections in your AI policy, but it also provides a menu of different provisions that can be adapted to your needs. So if there are provisions, for example, on data privacy, on transparency, accountability, and others, and they are developed based on evidence-based research and information. So one question that we often get is, how do we know we even need a policy? What are some symptoms or some signals? And so on this slides, you can see some, let's say, warning signs or red flags when you think you might need to start looking in the policies organization. So if you see your staff using AI tools, but there is not really clarity of how they can be used and for what purposes, if you're noticing that some outputs from AI systems may be influencing the decisions or appearing in publicly facing documents, if it's unclear if something goes wrong, who is accountable and how that will be looked through within the organization. All of those are signals that you might need to start looking at the developing guardrails or some guidelines or some policies in place to for the AI in your organization. In addition to, so once you decide that you need a policy and you need to update your policy, you don't want to jump straight into the writing of the policy. They're a good time to actually get together with your team and do a reflection, and you want to start looking into several questions. One of them is to understand what are you actually with this policy trying to safeguard and what you're trying to promote. Because every policy reflects organizational values, but also priorities. So for example, if your top priority is patient privacy, in your policy, you might want to safeguard or put in place the mandatory risk assessments before adopting AI tools. You might have a provision specific to strong encryption and data security standards. You might also have additional rules to safeguard around sharing data with external vendors. If your priority is accessible information, the way it can translate into your policy, you can put some provisions about making sure that the systems, AI systems you're looking at, or the tools have multiple languages and might be plain language or to improve digital literacy. Another question that you want to ask before drafting AI policy is, what is your organizational capacity to assess and govern AI tools and systems? Basically, who do you have on staff? Who will be responsible of doing that? Do you have those individuals on staff that have this capacity? What structures do you have in place? What IT structure, what compliance, procurement, where are the gaps? And if you're identifying that you have, for example, limited internal capacity, you might focus on low-risk use cases first. Then you can do like a phased-in governance approach. And you can also rely on external expertise for high-risk tools if they can support your needs. Another important part is you developing policy to really understand what already you have in place, what are the policies. Typical organizations have policies on governance frameworks, standard operating procedures, cybersecurity ones. So making sure that this policy interacts with those other policies as well. Other considerations, or I guess pitfalls to avoid, we sometimes put things in the policy that actually not feasible to implement or maybe really limiting. So as you're developing your policy, think about some of those elements and how to avoid them. One is you want to make sure that you're clearly defining your scope. We have seen policies on just generative AI, but if you just put a policy on generative AI, it means you are not thinking like broader. There might be some other systems that then would not be governed by your policy. You want to make sure that your policy is tool agnostic. What that means is that the landscape of tools evolves, and you want to make sure that this policy stands the test of time. So there's not really a particular reason to identify tools in your policy. They can be listed in an appendix if it's something that you want your staff to refer to. Visibility of provisions is really important. Why is it important? Because you want this policy to be operational and be implementable. So if your goal is to make sure that all systems are fully explainable, this is a strong and important principle, but particularly for a lot of AI systems that exist right now, it might be not fully possible. And so you might have heard that reference to AI systems as black boxes, because some of them are not, the more complex they are, the harder they might be explained, it's very explainable. So requiring particular in your AI policy to have all systems to be fully explainable might not be feasible. What you can do though in your policy is set the minimum documentation standards and require explainability when possible, rather than require full explainability. Adaptivity is another very important concept because AI landscape evolves really quickly. You want to put provisions in your policy of how often you want to make sure that this policy gets reviewed, what would be triggering of sunsetting certain provisions, and also what will be requiring, when there needs to be changes to make sure that the policy is current as possible. And Aaron already alluded to the idea that it's really important when development of your policy to have a cross-organizational team that has IT, that has legal, that have compliance, they have other divisions represented to make sure that it represents the vision of your organization. So another important, when you decide on the policy, it really comes to like, how do you actually structure it? What do we put in place? And there is not really one way to do it, but there are some ways that you can consider doing it. And I would like to show you 3 different types of structures that you can consider. So one of them is called operations first. And what that really means that you're first defining in your policy how tools will be approved, how they'll be monitored, how they're going to be documented, and then governance and enforcement are really layered on the top of that operational structure. And this report can be really practical and really allowing for some safe and ethical innovation within the use of AI. And so just to ground you a little bit on a practical example, so this is the example of this operational first structure. So in operational first structure, you will see that the most common kind of provisions at first will be the purpose, the scope, the applicability, how it's aligned with existing policies and key definitions. And then as you are moving into kind of the next part of that policy, you will have a provision specific to guiding principles, and then conditions for the responsible AI use, meaning that you will put in there, for example, risk-based framework or the type of tools, so procured versus publicly accessible, that, and what are some transparency and other important elements around those tools. And then ethical considerations, it's really good to have in the policy-specific sections like human oversight, bias mitigation, data privacy, and detail the provisions there as well. Next section, typically in that operations type of structure, is guardrails and accountability. So that's where you will put where prohibited uses are, what happens if staff is misusing AI, and really having a specific section on contractor vendor obligations for your policy as well. And lastly, in that particular process, that's when the governance and enforcement are layered kind of at the end. So you'll have a governance and oversight section where particularly will say who is going to be in charge of overseeing the policy implementation and providing any additional oversight. And so this is the operations kind of focus policy structure. So the other type of policy structure is governance. So in the governance policy structure, what you would see is having the governance framework as front and center. So at the beginning of the policy, you would have who will review the tools, what criteria will be used, how the risks are classified, and those who will be, so roles and responsibilities will be very clear in that structure. This is a more kind of a mature policy framework, and that particular framework is for organizations already have stand committees or bodies that can review and put policies in place. And enforcement is the last structure. So as the title suggests, the way you was this type of the policy structure is specifically where you try to really begin with what happens if something goes wrong. So you really put the provision in place at the very top of your policy is what happens if there's a data breach, algorithm harm, equity concerns, and then you build the rest of the policy is what will happen to prevent this. So this is particular, it can be powerful, but also requires very strong capacity, kind of a clear escalation pathways. And so once you decide on your policy structure, it's really important to build and be very clear who is this policy applicable to. Typically, the AI policies or other policies are applicable to all staff, but also contractors, grantees, and divisions. You need to really specify what requirements will be applying to the contractors and specifically for those who are also in progress. And you can see the box to the right side that provides some potential ways to structure that section. Typically, the policies are applies, if there's a contract that's already in place, they will be subject to that policy upon their renewal or amendment, and also will be provided a transition period for less complex, is about 6 months, for more complex systems are about 12 months. And as well as also while the policy, if they haven't had amendment or a transition period, they might be asked to make sure that they disclose any use of the AI during that period as well. One of the, I think, way to structure the policy is we probably would recommend to do risk-based oversight framework. So we have seen some groups that are interested or discussing about should we structure it by use case or should we structure it by tool. What we really would recommend is really going by risk-based oversight framework. What that means is that you are structuring your policy in a way that it says, here's the way that we will work within lower risk cases, and we'll define what lower risk cases are. Typically, they're internal operational tasks with minimal impact on the public, medium activities that inform or support public-facing work, and then you have a high risk, which is activities potential directly affect public health decisions, services, or trust. And so then if you use this framework, the rest of the policy will be layered to say what the type of oversight needed for each type of the layer and what the provisions will be applicable to that. If you use this type of framework, what will be helpful is you're not spending too much resources and oversight on low-risk tasks, and you're really intentionally spending more oversight on the high-risk tasks as well. In other pieces in this framework, it's important to differentiate between procured AI systems and publicly accessible AI tools. And why it is they're not all AI are made the same. So if you apply the same provisions on the same requirements for all the tools, you might be missing an opportunity, or as well as not safeguarding something that you should be. And so in the policy, there is an opportunity to differentiate between procured tools and those the formally that gets perhaps assessed through your IT department or through other divisions and decided that they will be used, enterprise-wise. But it's also important to say that not all procured tools have maybe the security measures that you need. So you need to look kind of deeper into that and decide which ones from the procured tools can be used for high-risk tasks. Publicly accessible individual personally tools usually should be treated the same. If you do allow your staff to purchase the tools or access the publicly accessible tools, you can have a provisions in your policy that just basically specify that it can be used for low-risk tasks and with appropriate oversight from the staff. And why is very important, why we're doing AI policies in the first place, is very important to secure ethical considerations, making ethics as a center of this. And so we know that there are some potential limitations with AI systems, and you can see ethical concerns on the left side, like incorrect outputs and reinforcement, potential to reinforce bias. If you over-rely on this, it can rely on impact, our critical thinking or human judgment. Some of the systems have limited explainability, and there's also some concerns about authorship. The good news is all of those can be addressed within the policy. You can see that there is on the right side, there is a specific sections and the provisions, specific sections in the policy that you can tackle each one of those in. And just give you one example, on incorrect outputs, human oversight section can be very powerful. And again, it can be structured by risk base. If there is, writing an email and using it for that, so it can be just a staff member reviewing and doing a different prompt and improving that. And if you're working with a vendor and the system doesn't give you, the correct output, you can work with the vendor to troubleshoot this issue. So there's all of those different ethical considerations can be addressed through that. The sections I just want to alert your attention on the page 13, we have on this toolkit that's been shared with you a detailed information about each of those sections and provisions. Again, as the menu options that take you from data privacy, training, capacity building, kind of a mid-blue layer that you can dig deeper and look at what provisions might make sense for your organization. And I will give it to Erin to wrap us up.
Yeah, and I think the biggest thing to take away from all of this, I hope people weren't showing up thinking, oh, like they're going to tell us exactly what policy needs written. It is more complicated than that because every organization is going to be a little bit different. And so with that, some of the key takeaways from what we just shared through our walkthroughs plus the guide itself is making sure you're thinking about things like your readiness, your AI readiness, not just jumping in and leaning forward into using these systems. We really want to take a structured, methodical approach and be intentional about that. Really have had a lot of success talking to groups about what Tatiana just went over in terms of that risk-based approach and thinking about it's not just a system, it's our approach to using these systems, especially on what's more or less risky for the work we do. This isn't something where the systems are just going to magically show up and work perfect. We need to know what's going on. So connect to national partners, local folks who are leaning into this work, identify some of the tools that are being used and best practices. This is not a one and done thing. This is a continuous effort. So going back to some of those building blocks, build foundational literacy, look at small scale pilot projects. And also there is funding out there in different sources that can help with data modernization and how you're leaning into AI and things like, especially if you're on the public health side, the public health infrastructure grant and data modernization. So just a few of those key takeaways. As we mentioned, Tatiana and I do a lot of talking about AI, so we're grateful that Metopio was willing to bring us on to talk about some of the policy things we have worked on. But we do everything from building that foundational conversation around AI 101 to identifying how we lean into the policy sides of some of those pieces. You can reach out to us via email, or we're both pretty active on LinkedIn. More than happy to connect with folks there. And if we have time, answer any questions today.
Great. Erin and Tatiana, thank you so much. This is just hugely helpful. As I think your summary slide there, Erin, was spot on. If like there's no one size fits all, and we can't just kind of hand off a template and say, here you go. But I think the ethical considerations, the framework, the steps, and Tatiana, I really appreciated the different ways to think about how you structure your policy, whether it's operations-based or risk-based, are really good prompts for our community to be able to use as they go along this journey. We are right at time, but very simple question. What does DMTTA stand for?
Yeah, sorry about that. So many acronyms. The data modernization efforts, and I forget the TTA, but it's the technical
Technical
assistance side
assistance.
that's available.
Training and technical
Training
assistance.
and technical.
Yeah,
Yes.
TPA. I know we are at time, so we will wrap this up. But if you do have questions, please feel free to email us at Metopio or Aaron and Tatiana. And thank you both again for providing so many resources and your time and expertise today. This is such an important area, I think, for people to get right and not to be afraid of, because there's so much potential for being able to deploy AI through a number of different public health use cases. But really making sure you've got the governance structure in place is issue number one at something that you need to tackle right out of the gate. So thank you both and have a wonderful day.
Thanks all.
Thank you.